difficulties in the crosswalks in our neighborhood, and that for the pedestrians, for those with strollers and carriages, and it's been really, really difficult. I'm sure, Josephine, you've probably gotten calls about that as well.
Yes, yes, lots of calls today. And many people don't realize it's the corner property is responsible, but I know on Fifth Avenue, the bid has been doing a lot of work. So that was the bulk of today, for sure. But we are live on YouTube, so I will turn it over for introductions to Ruth Grinfield Mazer and Pierre Lehu.
Okay, good evening, everybody. Thank you for coming this evening. I'm happy to say that we have two of our committees joining together today to hear our guests from NYU. So could you identify yourselves? And I guess we have Dr. Dara Khadib. Hello.
Hi, how's it going? Thanks for having us on. I'm an emergency medicine physician at NYU, and I'm joined by Dr. Goldenring.
Hey there. Thank you all for having us. I too am an emergency doc. Just want to say thank you all for having us. I'll do more of an introduction once we get into the talk today, but yeah, nice to be here.
Right. And we also, Ruth, have a representative from Public Health Solutions who, after the NYU Langone presentation, will also discuss with their organization. And we have Lear, yes, oh, Lila, she's here too as well.
Okay, great. Well, welcome everybody. Are the children, are the students on board watching, or?
Yes, as we invited students there. There's some in attendance and others watching us on YouTube.
Okay, well, since Ruth and I are not experts in vaping, I've never vaped. Whichever one of you experts wants to start, please go right ahead.
All right, that will be me. I'm going to share my screen. I have some slides, and I think Dara can comment at any point that he would like. We might have a couple others of our colleagues joining us at some point, but let's see. Okay, can you all see those slides?
Yes.
Excellent. All right, so one second. All right, so I'm going to be talking about the health effects of vaping, as has already been said a couple of times here. I'm Jake Goldenring. I wrote Jacob there. That's my given name. I haven't gone by that since my birth certificate. Feel free to call me Jake. But to give you a little bit of background on me, who am I? Well, I did med school. I'm a doctor. I'm an ER doctor. I work with Dara. I went to med school at Penn, and then I did residency here at NYU in Bellevue. And now I'm a healthcare leadership and operations fellow still at NYU in Bellevue in the department. So the goal is to one day, be able to help run a urban, large academic medical center. And more often than, I guess you could say that I'm kind of like Dr. Robbie from The Pit if you watch. Unfortunately, I'm not him. I didn't win a Golden Globe. I didn't star in ER, but we're kind of like the real life version, myself and Dara. But more importantly, I'm not going to call myself a native New Yorker because I'm not. I'm from New Jersey. But my wife and my daughter and I have lived in New York for a long time, and I consider myself an adopted New Yorker. And I care about what happens here, and I care about the health of the population in this city. So those are my motivations. And it wouldn't be a somewhat academic talk without an outline. I begin all of my talks with an outline and then make that same joke. Don't worry about it. But basically, for right now, we're going to be talking about a few things. We're going to do a brief background on the history of vaping in the United States when it was introduced, and the legal background around that. We're going to review current trends and who is actually doing the vaping. We're going to discuss at a high level, not a pathophysiologic level, but at a high level, how your lungs work on a good day. And we're going to walk through what happens to our lungs on a bad day, otherwise known as when we vape. We're going to define what E-Valley is. It's a cautionary tale. And then I'm going to conclude with a more global worry that I have about vaping in this country. So we'll kick it off with a background. So this is a nice timeline of kind of all of the things vape in the United States. And you can see that on the left there, they were first introduced in 2007. But before that, they were developed in China by a pharmacist by the name of Han Lik, Lik, and he is credited with that development. Um, as it says there, it wasn't introduced in the United States until 2007. But initially, the FDA actually tried to halt the import as they felt as though it was a drug device that required regulation and it wasn't initially being regulated. Of course, as sometimes does in this country, this led to litigation and it actually got as far as the District Court of Washington, D.C. It was a case called Smoking Everywhere, Inc. versus the U.S. Food and Drug Administration. That was in 2010. That's the red line there. I have several red lines and red boxes in this presentation. Those are things that I consider important. So pay attention to those. As far as and basically, what ended up happening was that they ruled that these devices needed to be regulated basically in the same way that tobacco products did. So from roughly 2010 on, when that ruling came out, vaping products were in the mainstream in the United States. This is more or less the anatomy of what a vape is. Going from left to right, you have basically an LED illuminator that says when the e-cigarette or vape is to be on or used or charged. There's that rechargeable battery, which is the green in the schematic. There is an atomizer, which is effectively a heat source. The cartridge, which is what contains the nicotine liquid, the THC liquid, whatever it may be, and then the mouthpiece. It's a pretty simple, um, schematic of a more complicated thing, but basically there's a heat source that's applied to a chemical, and then you breathe in those vapors without there being smoke. And I'm not going to bore you with organic chemistry. Believe me, I have enough trauma from that from medical school, but these are the things that are in the more or less all of the cartridges on the left, glycerin and propylene glycol. And when heat is applied to it, you get these things on the right, formaldehyde, acetaldehyde, and acrolein. And to make it a little bit more simple for all of us, formaldehyde is embalming fluid. So I would not recommend smoking this because it is something. This is a picture of an anatomy lab actually from Columbia, not the country, the university, and it is an embalming fluid. So you can imagine what that would do to your lungs when you inhale it. As far as who is vaping in this country, I have a couple of diagrams for you. So this is from the National Youth Tobacco Survey, which was in, basically spanned 2011 to 2018. And you can see that this is broken out by middle school versus high school. And it's also broken out by e-cigarettes versus any tobacco products. And there's two trends that I'll highlight, most notably that middle schoolers, though there is some background level of use, it's more of the high schoolers who are using both tobacco products or any e-cigarettes. And you can see this dotted line here. Can you guys see the mouse, by the way?
Yes.
Okay. You can see this dotted line here is the trend in e-cigarette usage in high school. And you can see between 2011 and 2018, this really took off from almost 0 to around 20% by 2018. To put this in a little bit more context, this is data from the Youth Risk Behavior Survey, which the CDC did and published in 2024. And these are percentages in the red box of people in high school who currently drank alcohol, currently use marijuana, ever use illicit drugs, ever misused a prescription opioid, or misused any prescription opioids at all. And you can see that these numbers hover around kind of 20% or so. I mean, maximum 20%. And then to go back to that prior diagram, you can see that this red line corresponds to kind of that background, the maximum use, which was, or the highest use, which was with alcohol related products. And you can see that e-cigarettes are quickly becoming much more of a problem. There's a much higher percentage of usage and they're a much more prevalent thing. And there's a lot of thought as to why that might be the case. there's a lot of advertising around it, similarly to how cigarettes were advertised in the 1950s and 60s. They are put out as being as cool products, and you are cool if you use them, but they don't engage in any of the risks of they don't they don't educate on the risks of what using the products might be like. So with that, I want to give us a little bit of background on how our lungs work generally, and then we'll talk about the specific effects that vaping or e-products have on the lungs. And so this is an altogether too complicated diagram of the lungs. It's taken actually from one of the American Heart Association's position papers on the medical effects of vaping. And there's a lot of jargon here, but I just want you to focus on the pictures more or less. And when you breathe in, you breathe it in through your nose, your mouth. It goes in through your trachea, goes into your lungs here through the bronchi. And I know that you all probably know this on some level, but just to like say it so we're all kind of refreshed. When it gets down to the very smallest part of your lungs, which are called your alveoli, this is this little thing here. It almost looks under a microscope like a bag of grapes or a bunch of grapes. That's where actually the gas exchange happens. You breathe in oxygen. There's little blood vessels around that bag of grapes that collect the oxygen and deliver carbon dioxide for you to breathe out. What's, I think, pretty cool about the respiratory system in general is that you have these cell borders that line the whole thing that effectively have this clearing function. So there are these cilia, they're called. They're little motile. Similar things are in your ear, similar things are elsewhere in your body, but they basically clear out all of the gunk and the mucus and the sputum that's produced at some background level. So when this is all working well, you breathe in, you get some good oxygen, you breathe out all the CO2 that your body had metabolized, and then you're good to go. But when we actually do vape, and I apologize for the slight lag there, but when we do vape, things change. First of all, the formaldehyde and the acetaldehyde that I mentioned before has direct effects on harming the cells that line the respiratory system. They harm the alveoli. It's generally just bad. There's increased cytokine production, which is basically to say there's a lot of inflammation and it causes cellular breakdown. Also, there's been a lot to show that there's more sputum production when you vape. So in addition to the breakdown of cells, you have more mucus that's clogging your airways. It also affects the alveoli, so the gas exchangers, because they're stiff, they don't transmit gas as well. And so the very fundamental part of your lungs, which is breathing in oxygen, breathing out carbon dioxide, is impaired, just by this vapor, just by the harmful chemicals that are in it. So as I said, you also get less clearing of all these bad things because the cells are breaking down, you have more sputum, and nothing is working as it should. And this leads to more wheezing, more asthma, more chronic bronchitis. And what is the end result of all of this? This is a medical paper. I will not bear you with the specifics, but it was published in the Journal of the American Medical Association. And these are all relative risks. I want to call your attention to the numbers 43 and 1.43, which correspond to this point here. And that suggests that anybody who has ever used an e-cigarette in their life is actually, or sorry, these are current users. The second dot here is ever any use, but this one here, current users, are 43% more likely to have any respiratory infection, or you can think of it as 1.43 times more likely. So if you are currently using e-cigarettes, you're 43% more likely to actually contract some sort of respiratory illness, asthma, chronic bronchitis, all those things that I had stated before. And so now I want to get into kind of what it looks like clinically, because Dara and I are doctors. These are things that we see while in the emergency department, and these are things that we deal with. And I want to give you an idea of what it looks like from our end, because I think it can be pretty impactful. So these are normal chest X-rays on the left, and a normal CT of your chest. So that's a CAT scan on the right. Basically, black is air, which is good. There's always a little bit of lung tissue that you can see, and there's the bronchioles and all the cartilage you can see on the chest X-ray. Obviously, that's your heart. And on the CT scan, it's the same. Black is good. So when aeration is good, when there's healthy lung tissue, you're seeing black on a CT scan. And now let's talk about what E-Valley is. And this will make sense in a second, the order. But E-Valley is kind of the severest form of vaping-associated lung injury. It is effectively e-cigarette or vaping product-associated lung injury. And in 2020, there's 2,800 hospitalizations from this, and 68 people died from it. So this is not something to be taken lightly. This is a reminder of what a normal chest X-ray looks like and a normal CT of one's chest. And then this is what it looks like when you have E-Valley. I'll go back. This is normal. Everybody can take that in. And this is abnormal. This is E-Valley. And you can see plain as day on the chest X-ray on the left, there's not a lot of black space, or there's far less black space than there had been on the normal. And you can see that corroborated on the CT on the right of the same patient, where you have all of this, we call them ground glass opacities, or just opacities generally, but you have all of this collection of inflammation, of consolidation, we call it, that makes your lungs not function well. And it means that your lungs are not appropriately exchanging gas, and your oxygen gets low, and it's not something that you want. And some people can actually be admitted to the ICU for this and need to be on a ventilator for a long time because it's a severe lung injury. And this has a lot of medical jargon on it too. There's also vascular effects in addition to the pulmonary effects. And this is all to say that basically this can happen. So this is a coronary angiogram. On the left, you can see more or less a complete occlusion. This is of the left anterior descending artery, which is otherwise known as the widowmaker artery. You can see that there's a complete occlusion here. And then after someone puts in a stent, this returns. So this big artery here was blocked. And this is similar to the effects that we think of with smoking, where there's more plaques that form, you get blockage of arteries, you get inflammation. And this is not just in the heart. This also happens in the brain, where you could potentially have a stroke. This happens in the big blood vessels, the aorta. This happens in the periphery, and you can have issues with blood flows to your limb. It's generally not a good situation. And there are also additional very serious effects, which I didn't go into all that much for this talk, but this is to say nothing of the addiction that comes with nicotine. Nicotine, as I think we all know, or can refresh ourselves, is the addictive substance that is in cigarettes, and it is also an addictive substance that can be found in most e-cigarettes or vaping products. And it's a very serious pathology, addiction in this country to that, as well as other things, opioids, benzodiazepines. But this is to say that e-vaping or e-cigarettes and vaping can also sometimes be a gateway to other drugs, other addictive drugs. And there's a lot of social pressure amongst people, especially when you look at that data from people in high school, to engage in these things, because there might be a social benefit to doing so. And that's not thinking about the actual health effects, and it's not thinking long term. And so this is overall my worry that will happen here. And I don't want to belabor the point, but this is data from the American Cancer Society. This is actually on lung cancer death rate, and this is also looking at per capita cigarette consumption. And so you can see that the dotted line is per capita cigarette consumption. So that's how many people smoke. It peaked around 1962-ish or so. And that's right around when the U.S. Surgeon General put out the report. That's right around when the Surgeon General warning went on to the actual cigarette product itself. And you can see that lung cancer deaths, so the people who died from issues with their smoking, was nowhere near its peak. That occurred some 30, 35 years later, closer to 1990. And my worry is that if you do the same logic in your head, and we didn't know enough about smoking when it was peaking in the 60s. We didn't know about its long-term effects. It took a while for this Surgeon General to put out these warnings, even though there was clearly something happening, as you can see before that. And my worry is that if that same thing happens with e-vaping or with vaping and e-cigarettes, then we're looking at something that we haven't even seen the actual end effects of. So, if you do the math, somewhere between 2035 and 2038, which is, a long time away, thank goodness, but we could see something similar, and that is my overall worry, that we don't know enough. We know about the harmful products in it. We know who's using it. We know generally what happens when you can get severe cases of lung injury from it, but we don't really know the long-term effects. And I think that I'd be a bad doctor if I didn't, leave you all with this, to say that we don't know enough. We have to critically think about the things that we do and critically think about the things that we put in our body, and just to have a little bit of perspective to learn from our history, because as has been shown time and time again, history is one of our best teachers. So I think that we'll basically conclude there, and then I can leave it open for questions. And I really appreciate you giving me the opportunity to talk with you guys, and happy to answer what questions that you have. So thank you.
Thank you for sharing all this with us. Do we have questions?
I have a question. What, comparing vaping to smoking cigarettes, what is the difference?
So it's a very good question. Comparing vaping to smoking cigarettes, the main difference being the tobacco. So tobacco is one of the more harmful products that is actually in the e-cigarette, or sorry, not the e-cigarette, in cigarettes generally, or other forms of tobacco-based product. And that has a lot of carcinogens in it. That is something that drives a lot of the lung cancer acquisition that you have in people who smoke. And there's less, yeah, so that is the main difference. I don't want to belabor that point, but the main difference is the tobacco that is in the cigarettes, and there is no tobacco that is in the vapes or the e-cigarettes, but there are other harmful products.
There is no tobacco in a vape cigarette. With vape, no.
No, there's nicotine, but there's no tobacco.
I see. So lung cancer rates should be therefore less with vaping than smoking cigarettes.
You would think, yes, but as I said, I don't think we know enough about the long-term effects of a chemical like formaldehyde or acetaldehyde to really say one way or another.
And what about the costs of cigarettes versus vaping, which I don't know what they are?
Vapor.
That's a good question. I mean, I don't smoke, I don't vape, so that's actually not information that I have right off the top of my head. But I think that when I last checked, cigarette, depending on the state you were in, or a pack of cigarettes was something around $15. I'm not sure, honestly. But as far as vaping, the cartridges are relatively cheap. The pens themselves are pretty cheap. I think less than cigarettes. So that's one of the things that drives the usage.
Danielle, I see you have your hand up.
Am I the next person?
According to you are. That's all I can see on this.
Okay, thank you. Yeah, my question is, in terms of vaping, how much you notice, and I know, again, you're limited in what you can see, but how much you notice that the patients are younger, and also how much is this damage, including the damage from like the plastics or the formaldehyde or everything else that's in it, how much more damaging are they on younger lungs?
That is also a good question. I don't think I have seen any data that suggests one way or another that it's more damaging on younger lungs. I think it just so happens that young people are mainly the people that are using those products, or younger people. And so it ends up being them that are affected by it.
And if I can just jump in, I think it goes back to Dr. Goldenring's earlier point, the slide that showed when the intervention was had by the Surgeon General. We didn't see the later effects until much, 30, 40 years later. So it's hard to say right now what the effects of these chemicals are going to be. We know that combusting tobacco is obviously harmful. We can likely hypothesize that doing the same with the liquids that are in e-cigarettes will also be harmful, but it's hard to quantify exactly how harmful compared to, tobacco.
I have one more question, actually, if you don't mind. What about secondhand vape smoke?
That's a good question too. I think when you think about secondhand vape smoke, I don't know if there's data on that. I think that, you can kind of logic that if the main harmful chemical that is in a cigarette or a cigar is tobacco, that is burned off and that is smoke that you inhale, as the person that's in the room next to you, or in the room. Yeah. But as far as the vapor from an e-cigarette, I tend to avoid it when I'm on the street or on the subway, but I don't think that there is as much of a one-to-one because it's not smoke that you're inhaling, it's vapor. And there is some product in there.
There's chemicals, there's scents, there's stuff.
Yeah. Yeah.
I think it's generally safe to say that inhaling any chemical probably isn't good for you. But I think it also just goes back to misconceptions surrounding vaping, right? A lot of teens think that vaping is just water vapor, and we know that's not true. There's plenty of other chemicals like Dr. Goldenring showed us. So while it might not be as harmful as inhaling tobacco smoke, it certainly is still harmful.
I see Ruth's hand up. So Barbara's hand was up first, I think.
Barbara, yeah.
Barbara, you want to go?
Yes, Doctor, this is a terrific presentation. I wish it could be made mandatory for all high school students. You illuminated lots, and I hope more people can hear your message. I'm very impressed.
Thank you. I really appreciate that.
So my question is, if a teen, let's say, stops vaping, what is the possibility for healing of the lungs?
Ruth, you are hitting me with the good questions. I think that the thing that sticks out in my mind is that there's no tar in an e-cigarette, in the same way that tar would build up for someone who smokes. Intuitively, it makes sense to me that there'd be more of a recovery. But again, I don't think I feel like this is our default answer right now, but we don't know enough to say that there isn't going to be a long-term accumulation of the formaldehyde or the acetaldehyde. And so again, as I was trying to point out, I think we're ahead of the curve. We're ahead of the peak of kind of the long-term effects of this. We're seeing acute effects, the short-term things, but I don't think that we know yet. And so I'm really hesitant to give kind of a firm answer on that.
You said that, of course, you can use vaping with THC, so that there's certainly no nicotine or whatever. Are the formaldehydes and whatever also as prevalent if you're vaping some sort of marijuana extract as nicotine extract?
Yes, those are the preservatives, or the chemical basis of the vapor. So you'll see that across all products.
Okay. Donna, you have your hand up?
Yes. Hi. I know that I've read that drinking is way down in today's teens. I was wondering if I know smoking was like has been rampant in teens for decades, but I'm assuming that's also down. Is the vaping comparable to how smoking was back in the day, or is vaping still less, or is it, you know what I mean?
Yeah, let me pull my slides back up because I think a picture is worth 1,000 words.
Mhm.
Okay, so this is answering kind of the first question. You said that
Okay.
the first statement where you said alcohol use is way down, and that is what the Youth Risk Behavior Survey would say, is that, as of 2013, 35% of high school drank alcohol, whereas in 2023, only 22%. It's still a very high percentage, but that's down. As
Right.
far as how that compares to smoking, sorry, there we go. This is data from the National Youth Tobacco Survey. Doesn't encompass the precisely same timeline, but you can see that any tobacco product in high school, that use is relatively consistent from 2011 through 2018. And then there is this kind of, spike in 2017 for both e-cigarettes as well as tobacco products. But you can see that e-cigarettes are catching up amongst high schoolers. It's still lower, or at least as far as 2018 goes, but it's catching up.
Okay. Thank you.
Yeah.
Josephine.
Yes, well, two things. First is we have a attendee who put a question in the chat that I'd just like to read. When you talk to teens about the dangers of vaping, what can you focus on and how to start the conversation?
Good question.
I'm
Dara.
happy to jump into this. I mean,
Go
I
for
think a lot of it is sort of explaining the framing that these companies are coming behind, right? It's while they may have marketed themselves as a way to quit smoking cigarettes, clearly their intention is different. And now we're seeing, 1 out of 5 high school kids vaping, and we're also seeing a lot of high school kids picking up cigarettes because of vaping, despite the fact that overall cigarette rate smoking is going down. I think you could discuss a couple different things. One is everything that Dr. Goldenring has discussed here, which is how vaping affects your lungs, how it affects your heart, how it affects your brain, right? Nicotine is an addictive chemical. The teenage brain is still developing and develops until age 25. Inhaling nicotine and smoke will result in worse athletic performance, more illness, needing more nicotine just to feel normal. And obviously the secondhand effects, right? The things that Dr. Goldenring mentioned, which is that it could potentially be a gateway drug, could potentially result in cigarette smoking. I think what doesn't work is just straight scare tactics. I think, kids are smart and they need to be approached with, some underlying, scientific background. And I think shaming language is generally not super effective either. But the earlier you get involved in these conversations, the better. The best time to approach it is prior to kids getting addicted. And obviously, we're seeing kids get exposed to it really early on now. So I think, we can't overstate the fact that this is super prevalent and it's really important to get involved early.
Yeah, no, I think that the younger kids, from upper middle school to high school, just, from I've heard, listened to anecdotal information is that vaping is lighter than cigarette smoking. There's lots of smoke shops around in the city, especially in District 10. There are lots of smoke shops, and you see these vaping that are all kind of nice colors and seem to be very attractive to young people. And I've heard of lots of stories of either adults trying to stop smoking who are using vaping, and very handy for young people in the home to once one tries it kind of goes around. And I think it's so important for us as a community to get the messaging out about the harmful effects, certainly of vaping in the community. So I do appreciate that.
And I think you touched on an important point, which is that these, the flavors, you see bubble gum and cotton candy, right? Like these are appealing to younger and younger teenagers. And also the fact that there's not as much of an odor as you would have with tobacco. So it's a lot easier to hide it. It's a lot easier to do it indoors, do it at school. So it might just be more difficult to know that, a teenager is vaping in the first place.
Jane Marie.
Hi. I think that one of the things that's clear is that when we do our regular education programs with our young people, that it always had that focus on drugs, and then drugs, alcohol, cigarettes came in, but vaping has to come in as one of those other avenues for addiction and for, ongoing health issues, as you have shared with us in your presentation tonight. So I think including vaping as part of the topics of what we are addressing, as my colleague Barbara mentioned, getting the word out to more and helping to hear this, perhaps with the guidance counselors from District 20, the guidance counselors in Community Board 10, by reaching out to the individual schools so that we can have the people who are on the front lines with children to be the ones to kind of get that information and help get that information out. The other thing that we can't forget is that selling these products to a minor is still illegal. It is illegal. They're not supposed to be sold to minors, and the fines have to match the crime, whether that is for the place that's selling it, whether that is for someone who's buying it for a minor, so that has to, again, the seriousness of it has to also be translated into our legislature.
Thank you, Jane. Ruth, we also have Lila Molina here from Public Health Solutions, and I know that you've done some work as well. And I appreciate you being here as part of the panel, because I know you've done a lot of work in that education and outreach as well. And happy to hear too what thoughts you have in helping us get this important information out into the community, especially to our young people.
Absolutely, and thank you for having me. That was an amazing presentation from the doctors at NYU Langone, so thank you for that. And I have a few slides too. I'll go through them not too slowly because that was already an amazing background and really everything on vaping and nicotine. So I'll share my screen if that's okay. One second. Okay, can everybody see this okay?
Yes.
Okay, beautiful. So yes, my name is Layla. I'm the Brooklyn Youth Engagement Manager with NYC Smoke Free and the Reality Check program. So today, yes, I'm going to talk about a little bit about Public Health Solutions, NYC Smoke Free, what the Reality Check program is, and of course, the topic of today, e-cigarettes. So a little bit of background about Public Health Solutions. We are the largest public health nonprofit in New York City. Our work is to improve the health of the city's most vulnerable families. We have a variety of health-related programs, including the Women, Infants, and Children's program, the WIC program, Whole You NYC, which connects Medicaid recipients to community resources and services. But again, today, I'm going to talk a little bit more about the NYC Smoke-Free program. So our program is using an equity and social justice lens. We are funded by the New York State Department of Health Bureau of Tobacco Control. And overall, these are a few of our initiative areas. So the first one really is focused on the retail environment. So what we want to do is reduce youth exposure to commercial tobacco product imagery. So when they're walking into a store, to a bodega, whether they're walking into one of those or to a gas station, anywhere where you can purchase a tobacco product, we want to make sure that they're prepared before they walk in there. And the point of sale, so when they're at the cash register and they're able to make eye contact with a tobacco product, whether that's cigarettes, e-cigarettes, nicotine pouches, which I'll talk about a little further on in the presentation, and also including social media. We know that it's not only physical places that they're seeing tobacco products, it's also on social media. We're so interconnected with other places throughout the world. So even if, for example, tobacco products, I know for the US are not allowed to be displayed on commercials, on TVs, it's very easy to get a retweet or something reposted from another country or from a friend from another country. And you can easily see marketing in that sense that you might not be able to see in the US. So it's very easy to see that through social media. So we want to make sure that our youth are prepared to see those things and how to combat it when you do get in contact with that. One of our other initiatives is to combat the e-cigarette epidemic and the flavored tobacco products accessibility, especially when we're talking about communities of color. When we think about menthol flavored tobacco products and how that has impacted the Black community and the Latino community specifically. When you think about menthol flavored cigarettes, 85% of Black smokers use menthol flavored tobacco products, and 65% of Latino smokers use menthol flavored tobacco products. And this is because of very targeted marketing from tobacco companies to communities of color. Again, we always try to impress upon people that this is not a coincidence. This doesn't just happen overnight. This is because of targeted marketing from the tobacco companies. One of our other initiatives is smoke-free housing policies. So we do work with building managers, with landlords, and with people who live in multi-complex apartments and other forms of housing as well to adopt smoke-free housing policies. So for example, sometimes we might get calls from someone who has a newborn baby or who might have a respiratory issue, and they might live downstairs or upstairs or even across from a neighbor who is smoking, and that might be exacerbating one of their own issues. So we try to work with them to create a policy, again, a voluntary policy without involving enforcement or law enforcement for the complex or for the apartment complex. So for example, working with the buildings agency to maybe have a policy come in place for no smoking in shared spaces. And then working with people to maybe have a policy in place for their own homes if they don't want smoking in their own homes. Of course, creating smoke-free spaces to reduce the exposure of secondhand smoke. And one of our newest initiatives is a tobacco-related environmental waste initiative, tobacco product waste. So the most littered item on the planet is actually cigarette butts. And so this new initiative is focused on the environmental impact of tobacco litter, not just cigarette butts, but e-cigarettes as well. What to do with e-cigarette waste and how we tackle that issue as well. And we do this through community engagement, youth engagement, and media campaigns. We like to say that we're a small but mighty team. There's only 2 people for the Brooklyn borough, but we do the best that we can with the small team that we have. So youth smoking rates in New York City, and this is from the 2023 DOHMH data that we have for the New York City Youth Tobacco Survey. So 9,000 New York City public high school students currently smoke cigarettes, and 32,000 New York City public high school students report using e-cigarettes. And so we know these numbers are much more likely to be higher. Again, especially for the e-cigarette number, this is self-reported. We know that there can be issues with self-reporting data. For example, even if it is anonymous, some students still want to self-report this data. And I will say these numbers there is an uptick from the 2021 data. So we know there's a lot of work that needs to be done on our end to help with this epidemic. So the reality check program and something that we work on with NYC Smoke Free is a student-led adult-supported program. And this is across New York State. It's not just in New York City. And we work on tobacco control initiatives. This is for students ages 13 to 18. And overall, what we do is try to end the tobacco epidemic in New York City. And we do this through trying to produce change in communities through a combination of education, advocacy, outreach, political education, and media campaigns. And we do have a reality check program in each borough. We do have this in multiple schools. So again, this is ages 13 to 18, although we do presentations for younger youth as well. Again, we know that e-cigarette use, tobacco use is not just something that falls between just the ages of 13 and 18. There is data that shows that there are younger youth that initiate tobacco use as well. But for reality check specifically, it is 13 to 18. And we do aim to expose the tactics of the tobacco industry. And again, we do have this in all 5 boroughs. And this is a great opportunity for students to use their voice, use their choice. Again, we do say student-led adult supported because we like our students to be in the limelight. We can sit here all day and give presentations to them and kind of drone on to them, but it's really great when they're the ones giving the presentations or talking to their peers when they see someone who looks like them and who's their age, shining light on these issues as well. So electronic nicotine delivery systems. This is just a fancy word for e-cigarettes, or ENDS. They're also called, as I mentioned, e-cigarettes, e-cigs, vapes, e-hookahs, or vape pens. And they can look like a variety of different products. So cigarettes, cigars, or pipes. They can also look like USBs or pens. And on the right, you'll see a graphic. I'm just showing some of the examples of what they can look like. So pipes, some of the large tank devices, medium tank devices, and disposable e-cigarettes. They're used to deliver nicotine, marijuana, and other chemicals as well. And they're classified as tobacco products because they contain nicotine, which comes from tobacco. And just to show a little bit of this here, nicotine is derived from the tobacco plant. And again, it is found in cigarettes, e-cigarettes, as well as other tobacco products. It can rapidly use or reach the brain after use, and this can trigger the release of dopamine. And what happens from here can be a cycle. There's a reward response, and it can reinforce use of nicotine. So releasing more dopamine and then wanting to continue using nicotine or e-cigarettes or products that, again, contain nicotine. And a lot of young people who use e-cigarettes are more likely to smoke cigarettes in the future. So this is just a graphic from the CDC to show an example of what some e-cigarettes may look like. And again, they can come in a variety of different forms, shapes, colors. And I think it's, again, very important to note why they look like this. They're very brightly colored. They come in a variety of different flavors. And these are all things that appeal to youth and to a younger audience. So this is just a picture that we put in here just to impress upon our youth and anybody who's just listening and watching about how insidious these products can be. Even when I first saw this picture, it was difficult for me to see which item was not an e-cigarette or which of these items was not an e-cigarette. And surprise, surprise, the answer is actually the little yellow squeeze box on the bottom and the blue one next to it. Those are the items that aren't an e-cigarette. Everything else here is an e-cigarette. So we have something or like a phrase that we say in NYC Smoke Free or just with our sister grantees as well. It's like when you're working in tobacco control, it's like you're playing whack-a-mole. There's always another product popping up. So you feel like you got one down, there's always something new coming up. And one of the new things that we see too, if you look at that watch there, is smart vapes or smart e-cigarettes. And they have screens or you're able to charge them and you see a screen on it. And there's games that we've seen on them. There was one where you had to have a certain amount of puffs throughout the day to save an animal on the screen, like a dog. So again, very insidious, very discreet, very easy to hide and to make it look like another product. And again, as you see in the bottom one, that even looks like an inhaler. So a lot of work for us to do, but just to impress upon how crazy it all can seem. So for youth e-cigarette rates in the US, they are the most used tobacco products among middle school and high school students. 1.63 million students currently use e-cigarettes. Over 400,000 middle school students report using e-cigarettes, and over 1 million high school students. And this is from the Food and Drug Administration. And so youth smoking rates in New York State specifically, this is from the New York Youth Tobacco Survey. These numbers go from over 2000 to 2024. And if you follow that red line with the red triangles, you can see there's been significant progress since 2000 in terms of youth using cigarettes. So in 2000, it was about 27.1%. And if you look to 2024, the rate is at 2.4%. So again, there's been immense change, and that comes from new laws being passed to Tobacco 21, to increasing the price of cigarettes, to the Smoke-Free Air Act. But there's still a lot of work to do. If you look at the yellow line, again, you can see where e-cigarettes, where the data started to be collected. And there was a pretty big incline and spike around 2018. And that number has gone down a bit, but there's still a lot of work to do. And when you look at the number for any tobacco products, we've seen that number pretty high, 17% for 2024. And this isn't even accounting for the newer product, which is nicotine pouches. So what's in the smoke? Again, as was mentioned in the last presentation, there is a common misconception that because the name is vapes or e-vapes, that it's just water vapor, which is very much so not the case. We know that there's ultrafine particles in e-cigarettes, that there's aerosols, there's flavorings, and so many different chemicals, as well as heavy metals such as nickel, tin, and lead. And there's just a graphic on the right from the CDC just to show a bit about these substances in e-cigarette aerosol as well. And to talk a little bit more about smokeless nicotine products, these aren't new. There have been smokeless tobacco products that we're aware of, for example, chewing tobacco, snus. But smokeless nicotine products are microfiber pouches, and they have nicotine powder in them. So they're able to dissolve in the user's mouth without spitting, and people will put them between their gums, and that's where the nicotine will dissolve. And these are very discreet. They become very popular in the US. They were originated in Sweden and took the US market by storm. And the most recent data that we have is that 1 of every 42 high school students are reported using nicotine pouches in the past 30 days. And this is from the CDC. Some of the side effects reported were hiccups, gum irritation, nicotine addiction, sore mouth, and upset stomach. As of right now, for Zyn specifically, 20 have been authorized by the FDA. Not FDA approved, but legally allowed to be sold in the US. And the issue with smokeless nicotine products is that they have certain loopholes that tobacco products don't have. Because there's no tobacco in these products specifically, they're able to advertise in ways that tobacco products aren't. For example, I've seen Zyn product advertisements on my own YouTube channel in the past few days, and that's not something tobacco companies are allowed to do. So they definitely have loopholes that, again, tobacco products don't normally get. They're also allowed to be sold in stores where if, for example, a bodega or a corner store doesn't have a license to sell tobacco, they're still able to sell Zyn products because, again, these only have nicotine in them. So we know that tobacco companies target youth as their audience. They do this by using flavored products, by making their products widely accessible through social influences, whether this is influencers on TikTok, Instagram, and by accounting for brain sensitivity. So talking a little bit about product accessibility, if you look on the right here, there's a graphic that just shows in New York City, there's 35 times more tobacco retailers than one of the most prolific fast food chains. We have over 7,000 tobacco retailers within 1,000 feet of public schools, between 94% of public schools. So the majority of students, when they're going to school, they're going to pass a tobacco retailer, whether that's a bodega, a deli, a corner store that sells tobacco products, or a smoke shop. And students are more likely to get their products from these stores, whether that's a local store, gas station, again, or a smoke shop. And we know these products are colorful, they're enticing. There are so many advertisements, whether physical in front of them or on social media, and they're very close to their homes. So there's some of the flavors, just to give you an example, on the left. And there's just so many. It's mind-boggling to think about. They add flavors to their products to attract youth and to attract teens. And more than 85% of youth who use e-cigarettes report using a flavored product. They're not using tobacco flavor typically, or something that tastes like a cigarette. The issue with flavors is that it makes it easier to start smoking and harder to quit. Most flavors reported by students are fruit, candy, and mint. And again, as I mentioned, the numbers are mind-boggling. There's over 15,000 unique e-cigarette flavors available online. Some of them here, as you can read yourself: cupcake, fruity pebbles, menthol, chocolate, sprinkles, something that is very, very appealing to youth. and some of the social influences. The tobacco industry is a multi-billion-dollar industry that has so much money to do research, to be branding, to do advertising. They're able to promote their brands. They're able to research what appeals to youth, and really find loopholes, for example, with ZYN and nicotine pouches, in ways that they're able to advertise. This is just an example of some of the advertisements that were seen decades ago. I know we talked about in the last presentation, cigarette use back in like the 1920s, 30s, 40s. These are some of the advertisements from back in the day. Bold Cool Newport, menthol flavored tobacco products. There was even doctor endorsements very, very long ago of certain cigarette products. And then how it's evolved to now. Very bright colors, using cartoon characters, using flavors that will appeal to younger audiences, and even co-opting treats like ice cream and candy to appeal to youth from treats that might have been used in their childhood or as teens that they used or that they indulged in their childhood. So for brain sensitivity, we know that for youth, their brain is still developing and is very vulnerable to nicotine. And that nicotine withdrawal can worsen anxiety and depression. Youth can vape to relieve those symptoms. And then again, as we mentioned in earlier slides, it can create a cycle of addiction. So you feel more anxiety, you feel more depression, and you feel like you need to rely on nicotine for happiness and for dopamine. And young people can show signs of nicotine addiction very quickly, even before they're regularly using nicotine. And again, as was mentioned in the last presentation, e-cigarettes are still very new, and we're still learning more about the long-term health effects. What we do know, again, is that most e-cigarettes contain nicotine, and nicotine is very highly addictive. It can harm adolescent brain development, which is still developing, and that they can cause unintended serious injuries. We know that defective e-cigarette batteries can cause fires and explosions, and that's something that we also talk about on the environmental side, as well as just in general, the negative health effects. So I know this is something that was asked, are e-cigarettes safer than traditional cigarettes? And this is a question that we get from youth as well. And what we just try to impress on them is that nicotine in any form is highly addictive and harmful. And the context is important, especially when it's coming from someone who has never smoked before or has never used a cigarette. The use of any tobacco product, including e-cigarettes, isn't safe for young people. Again, these are things that we try to impress upon our youth. And studies show that youth who use e-cigarettes or ENDS products are more likely to try regular cigarettes than those who don't use e-cigarette products. And so for us at NYC Smoke Free and Public Health Solutions, how do we address this issue? We meet with our city council members to educate on the issue. Each year we have a trip up to Albany. It's actually coming up next month called Legislative Education Day. And we bring our youth with us and they're able to talk to elected officials about the work that they do with NYC Smoke Free and the Reality Check program. They're able to directly connect with their council members and talk to them about what they're seeing in their schools, what they're seeing in their community. And that's one of the great ways they're able to get politically involved, but also share their voice and connect with other youth and kind of if they haven't gotten their foot in the door before political engagement, really get to see how they can create that change. We also attend church meetings and participate in community events, whether that's tabling, coming to amazing presentations like these, or presentations at schools with staff as counselors, so substance abuse prevention, intervention specialists, and guidance counselors. We educate community members and influential leaders. We showcase the short film Black Lives, Black Lungs. That is an amazing short film that you can find on YouTube that really delves into how the tobacco industry affected the Black community through menthol flavored tobacco products. And we also participate in parent meetings at local schools too. So please feel free to connect with us with local schools or youth serving organizations. We love to educate administration and staff and students about tobacco use and big tobacco. and so that they can go on and further educate one another. Our students help lead workshops with their peers and their parents. Really, the whole point is to build community awareness and education. We don't lobby, so we're not going up to Albany to ask legislators to pass any bills or to make any specific action in that way. But our whole job and what we really do is educate and build community awareness. So that is my spiel. This is the information for some of the other reality check coordinators. Mine is the first there, but if there's anybody interested in connecting with anyone from the Bronx, Queens, or Manhattan, that is some of the information there. Thank you so much.
Thank you.
Yeah, thank you. That was great.
Thank you. This is a very, very thorough presentation. And
Ruth, we had one more question in the chat that was raised from a YouTube viewer saying that appreciating the important forum. My 14-year-old is a local high school student and was hospitalized about 6 months ago with a severe lung infection caused by vaping. I do believe there's a lot more education that needs to be out there because young people in the community have easy access, and I think information is power. Do either NYU Langone or Public Health Solutions visit local schools, and is it possible to connect? So I think that that last screen, there were ways, but certainly we can, put that information out there. I'll turn that over. And she said, stressing upon there's also short-term health effects as well as long-term health effects because her son had a lung infection.
Yes, I'm so sorry to hear about your son. I really do hope that he has a speedy recovery. And yes, we absolutely do connect with local schools. Depending on the borough for Brooklyn, I'm the person that can be reached out to, and I can put my information in the chat. And also CB10 has my information. I can reshare that too. But absolutely, we connect with local schools, we give presentations. And if students are interested in forming a reality check chapter at their school, that's something that we absolutely do.
Jane?
I was just going to say that perhaps we can share it with the CEC for District 20 so that the parents can also hear about this. I think that that would also be very powerful because just as the parent who was on this call expressed, I think this would be very helpful for not just the schools, but for families as well. So perhaps that's something, Josephine, that we could share with the CEC. Thank you.
Absolutely.
okay, are there any other questions or comments about our wonderful presentations? Okay, so I want to take this opportunity to thank our three presenters for coming tonight and giving us so much information, really a lot of information. Now I have this fantasy of stopping the next person I see vaping on the street and just shaking them a little, but I'm not going to do that. So, I was certainly aware of the problems, but you gave us a lot more information and really heightened our awareness about it. And there's just so many more things to it than I realized. So I thank you very much. And I think I'll take this opportunity, if there are no other comments, to end this meeting and